Many successful herbal treatments start like this. Some doctor learns that some plant has been used by some ancient medical tradition, like ginger for headaches, and figures, hey, they've got patients with headaches, and since it's just some safe, common spice, advises one of their migraine patients to give it a try. At the first sign of a migraine coming on, the patient mixed a quarter teaspoon of powdered ginger and some water, drank it down, and poof! Within a half hour, the migraine went away. And it worked every time, no side effects. This is what's called a case report, which is really just a glorified anecdote, but case reports have played an important role in the history of medicine. AIDS was first discovered as a series of case reports. Some young guy walks into a clinic in Los Angeles with a bad case of thrush, and the rest is history. Or reports of an unusual side effect of a failed chest pain drug leading to the billion-dollar blockbuster Viagra. Case reports may be the lowest or weakest form of evidence, but they're often the first line of evidence. That's where everything begins. So a report like this isn't helpful in and of itself, but it can inspire researchers to put it to the test. The problem is, who's going to fund it? The market for migraine drugs is worth billions of dollars. A quarter teaspoon of powdered ginger costs about a penny. So who'd fund a study pitting ginger versus the leading migraine drug? No one. Until now. A double-blinded, randomized, controlled clinical trial comparing the efficacy of ginger to sumatriptan, also known as Imitrex, one of the top-selling billion-dollar drugs in the world, in the treatment of migraine headaches. They tried using just 1/8 of a teaspoon of powdered ginger versus a good dose of the drug, and they both worked just as well, just as fast. Most started out in moderate or severe pain before, but after the drug or ginger ended up mild or pain-free. The same proportion of migraine sufferers reported satisfaction with the results either way, and so as far as I'm concerned, ginger won. Not only because it's a few $billion cheaper, but because there were significantly fewer side effects in the ginger group. On the drug, people reported dizziness, a sedative effect, vertigo, and heartburn. The only thing reported for ginger was an upset tummy in about 1 in 25 people, though taking a whole tablespoon of ginger powder at one time on an empty stomach could irritate anyone's tummy, just as a note of caution. But sticking to 1/8 of a teaspoon is not only up to 3,000 times cheaper than the drug, but you're probably less likely to end up as a case report yourself, of people that have had a heart attack or died after taking the drug. Ginger is most famous for its role in preventing and alleviating nausea and vomiting, with so many studies now that there are reviews of reviews, not just in morning sickness, where just a half teaspoon of powdered ginger is associated with a 5-fold likelihood of improvement in nausea and vomiting in early pregnancy, but also for motion sickness, and post-operative nausea and vomiting after surgery, and preventing antiretroviral-induced nausea and vomiting during HIV treatment, and as a miracle against chemotherapy-induced vomiting. In this randomized, double-blind, placebo-controlled clinical trial of ginger for breast cancer chemo-induced vomiting was relieved in all phases, meaning in the acute phase within 24 hours of the chemo, delayed vomiting 2 to 3 days later, and even what's known as anticipatory vomiting, which occurs before chemotherapy sessions, after a few times the body knows what's coming and starts throwing up even at the thought of it approaching. This anticipatory nausea is something drugs can't seem to control, even the fancy new anti-nausea drugs that can cost 10,000 times more than ginger, which comes in at about 2 pennies per dose, and in certain ways may work even better. I've also talked about ginger and pain. An eighth teaspoon of powdered ginger, 1 penny, found to work as well as the migraine headache drug Imitrex without the side effects. And speaking of pain, ginger may also be effective as ibuprofen for alleviating menstrual cramps. Painful periods are exceedingly common and can sometimes cause severe suffering, yet have been virtually ignored by pain management researchers and practitioners. But 4 randomized controlled trials have been published on ginger for menstrual pain, and all 4 showed significant benefit when taken just the first few days of your period. Effective doses range from about 1/3 of a teaspoon a day to a full teaspoon a day, but since they all seem to work about the same, might as well just start with a penny a day dose. And as a side benefit, it can dramatically reduce heavy flow, which is actually one of the most common gynecological problems for young women. We know that there are pro-inflammatory foods that may contribute to heavy menstrual bleeding, so how about try an anti-inflammatory food like ginger? Heavy menstrual bleeding is defined as more than 1/3 of a cup, or 80 milliliters. All of the study subjects started out much higher than that, but just an 1/8 teaspoon of powdered ginger 3 times a day, starting the day before their period, cut their flow in half. And it seemed to work better each month they tried it, providing a highly effective, cheap, easy-to-use, safer treatment for menstrual blood loss and pain. So, works for migraines and menstrual cramps, but just because it's effective for many types of pain doesn't mean it's necessarily efficacious for all pain. For example, how about intestinal cramps? Is ginger effective for the treatment of irritable bowel syndrome? And the answer is yes, dropping IBS severity by over 25%, but so did the placebo. So the real answer is no. Ginger is not effective for the treatment of irritable bowel syndrome. Yet, ginger is one of the most commonly used herbal medicines for irritable bowel syndrome. Silly people! Don't they know it doesn't work any better than a sugar pill? Or, from another perspective, smart people using something that offers relief 53% of the time, and doesn't risk the adverse effects of some of the other drugs, with which doctors may harm one person for every 3 they help.